In early 2010s, African economies went on a borrowing spree, mostly from the IMF, World Bank, and China to finance infrastructure. In 2020, Sub-Saharan Africa debt stood at around $702 billion, up from $305 billion in 2010. Public debt has now climbed to above 50% of the gross domestic product of nearly half the countries in Sub-Saharan Africa. Around 92% of loans to Sub-Saharan Africa were from multilateral institutions and the remaining 10% from bilateral creditors. To date, Africa owes China, one of the largest bilateral lenders of the region, $145 billion. How does this affect Africa's fight against COVID-19? Debt burdens have eaten into critical state functions such as funding healthcare and education. For example, according to UNICEF, South Sudan's budget for debt servicing in 2019 was 11 times more than its budget for social services. In Haiti, Gambia and Chad, it was 3 times over. Compared to OECD countries that spend above $4,000 per capita on health, African countries only spend between $8 and $129 per capita. Currently, more than 2 years into the COVID-19 pandemic, the African continent has only vaccinated 3% of its 1.2 billion people, compared to Europe with a 50%, North America with 45%, South America with 35%, and Asia with 33%. A major reason is the lack of available vaccine supplies ready to be deployed to health centers. Very few African states have been able to secure significant vaccine batches from pharmaceutical firms or from donor countries' donations through official development assistance, widely known as aid. Meanwhile, Africa's vaccine production capacity makes up less than 1% of all vaccines administered across the entire continent. This can be attributed to the neoliberal onslaught on healthcare systems and corporate control over research and design, such as World Trade Organization's TRIPS. The Big Pharma. Big pharmaceutical corporations profited $1.27 trillion in 2020. Their huge budgets have critical influence over national and global health pacts and laws. In Africa, the Big Pharma is aiming to cash in on the healthcare and wellness sector, estimated to be worth $260 billion in profits by 2030. Many African regimes have outsourced most of their scientific and research-related programs to these big pharma and private firms, making state policies tilt in favor of them at the expense of their citizens' welfare. What can the people do? The journey of fixing African healthcare and economies requires global answers. Number 1, debt cancellations. Number 2, ending TRIPS and corporate control over health intellectual property rights. 3, realizing donors' official development assistance pledges. 4, setting progressive tax policies. 5, fixing tax loopholes. Social movements and civil society organizations must also demand for greater accountability from their governments and assert their rights and sovereignty on the national budgetary priorities.